Hi, everybody. Welcome to this episode. I'm here today with Sam Barry, who is a detransitioner, and we first met on Twitter. So, Sam, thanks so much for agreeing to do this. I'm looking forward to talking to you today.
Yeah, me too. Thanks for having me on.
Absolutely. So, just to start us off, could you tell people a little bit more about you, about what brought you to Twitter to start talking about your detransition?
Yeah, certainly. For me, it sort of fundamentally stems from me having bipolar, and I started receiving treatment for it last year. And upon starting the treatment, that's when I kind of realised the transition I'd gone through was not the right decision for me. And then I started to reach out to other people who had gone through what I'd gone through, found this community on Twitter, and I sort of decided after receiving your message and talking it with friends and family over Christmas that I'm at a point where I finally want to tell my side of the story.
Okay, yeah, excellent. So, are your friends and family pretty supportive of you throughout this process?
Yeah, yeah, they really are.
Okay, that's good to hear. That can definitely make a big difference, so that's really good. Let's kind of go back a little bit. When did you first start identifying as trans? You mentioned it, had to do with your bipolar diagnosis, but where did that first start for you?
So for me, it really first started when I went to university. Um, Before then, I knew that I was gay. Uh, and then upon moving to uni, some of the friends that I made there kind of said because of certain behaviours and traits I had that I was more likely to be trans than gay. Coupled with some sort of negative reinforcement I had around being gay, it just seemed to make sense as a means to run away from my sexuality. To live as a straight woman rather than a gay man. Uh, yeah.
Okay, so the friends at university, when you guys had those discussions, what did that kind of sound like? How did they bring that up to you?
It was more out of a place of like, I suppose, concern for them, more a place of like love than it was them trying to put down my sexuality. I think I've always been quite open with my friends, and I tended to wear. Essentially, I used to like just cross dress, not dresses and skirts and stuff like that, just like the pajamas and things. And they would say, well, because of that behaviour, clearly this is, the root cause of it. Um, and I think coupled with not knowing that I had bipolar at the time, if I slipped into manic episode, it would be very easy for me to just go along with it and think, yeah, this is the right thing that I need to do. This is making me feel better. And then when I would slip into depression from it, I couldn't even really think about it. It was so out of my scope, just trying to survive.
Okay, yeah. So you've got the two threads here so far, the
Mm.
bipolar and then the transgender identity. And let's try to kind of, we'll sort those out and see how that unfolded. So I'm curious about the bipolar disorder. When did that start for you?
Looking back, probably about 16, having the kind of it's mood swings, but not in a daily sense. It would be a couple of months of being manic, not sleeping, uh, doing risky sort of behaviours, and then maybe a week or two of normalcy, and then slipping into what was suicidal depression. And the goal in there was just to survive.
And at the
But
time, oh yeah, I'm sorry. Go ahead.
oh, sorry. Um, and that kind of continued on to about the age 33 when I was diagnosed just last year. And receiving the treatment then, it was like I could look back and think, oh my God, what all these things I've done, like the behaviour is finally explained.
Wow, that must have been a really powerful moment when you were
Mm,
diagnosed. So you're 34 now?
yes.
Okay. And with the bipolar, when you were a teenager, when that first started, did you think that this was just sort of teenage angst, or did you feel like you mentioned it felt like depression. What did you kind of make of that? Or did you feel like there's something deeper going on here?
I always felt like there was some root cause to the depression. The mania, it felt amazing, when you're in that sort of really high mood. The depression, I always tried to find the meaning behind it. Like, why am I feeling like this? And it would be like, oh, it's drinking too much caffeine that's causing poor sleep and that. And something that was sort of ever present was, oh, it's clearly because of gender dysphoria. Um, I'm not happy with my body. That's why the depression is. So I have to go through with everything in order to cure it.
Okay. So what did the gender dysphoria feel like in the early days around like 16, 17? What did that feel like for you in your body and your mind?
For me, it was kind of a case of, I almost felt like, for lack of a better term, a sort of disgust with the thought of myself as being a man with a man. And it felt like the right decision to make to try and escape those feelings. And I've always had a lot of positivity, especially from my mum. She knew that I was gay from a very young age, and she's always been very, like, she hasn't discouraged me or anything like that. But what I've found looking back is you could get 100 positive comments about something, but it's the one negative that will always stick in your mind. And I had some very negative sort of reactions around coming out.
Okay. Where did those come from? Where did those negative reactions come from?
Some was sort of society as a whole, like especially because I grew up sort of the 90s to early 2000s, and it was very common in like the media, just people talking in general, to sort of mock gay men and like lesbians as well. So that kind of negative response from society as a whole um, kind of pushed me into a box. Like, I can't identify as that or be that because I will get that negative backlash. I know I did get comments as well, like slurs thrown towards me, that made me want to shy away and hide and
Yeah.
transition.
Okay, yeah, so absolutely. It's one thing to get that kind of positive response from your mom in the home, but then it's another to know that kind of going out into the world, you're not
Mm.
getting that same response and you're kind of getting that coldness or rejection or judgment. Um, when you had that gender dysphoria feeling, was it mostly about that sense of society or people would punish you for being gay, or was it or did it have to do with your body? Did you have feelings of, hatred, disgust, or anything like that with your actual body?
Uh, so the sort of background was very much the fear of society and being openly gay in public, the negative reactions around that. I'd say I definitely have had body dysphoria, especially like around uh, going through a male puberty and body hair, that sort of stuff. And there was a lot of that was almost formed into an obsession towards my own genitalia. That I have to get rid of this because this part of me is representative of everything I hate or can't face into.
Okay, yeah. And to fast forward a little bit,
Mm.
what did you end up doing for transition medically?
So I went to the Tavistock. No, not Tavistock. What's it called? Whatever the clinic's called in London, I can't remember.
Okay.
um, I went there probably about the age of 19. Was quickly given testosterone blockers and hormones. So I've been on them since about 19. Eventually, after a few more appointments, I did end up having the genital surgery. Um, I think I dug through some paperwork the other day to find out exactly when it was. 2013 that I went through that. So I kind of went through the full process, and was discharged from them in like 2014, something like that.
Okay, so were you 23 when you got the surgery?
I think about that, yeah.
Okay. Did you have any other surgeries, like
No,
breast implants or anything?
no,
Mm-mm.
no, thankfully
Okay.
not.
Okay. Yeah. All right. Wow. So that's a lot. That's a lot right there. And 10 years later now, um do you feel regret for that surgery and that medical intervention?
Yes, absolutely. There's when I started taking the treatment for the bipolar, it almost woke me up, and I started to look back at these things like I bought a car which I really could not have afforded, um, all sorts of like things that would be out of character for me now, and I kind of woke up from the fog and the haze, and I thought, oh my God, what have I done to my body? Um, and I do still, I'd say daily, have those moments of regret, like waking up expecting certain body parts to be there and they're not. Um, it's, I think, something that I'm still dealing with, uh, trying to sort of come to terms with.
Mm-hmm. For the intervening years between when you transitioned and then when you were diagnosed with bipolar, for that period of time, was that were you feeling good? How were you feeling during that time? Regarding your transition, mainly.
Um, it it was kind of weird because after the surgery, I slipped into a period of mania. I felt amazing, finally happy. I finally done it. Um, the goal that I'd set out was achieved, and that would be the cure to the depression. But then the cycles just carried on anyway. Um, so for me, it was more that clearly wasn't the source of my depression. However, it was still something I had to do. Um, it it didn't really even enter the back of my mind that that might not have been the right decision to make. It was just, I've done it. I just got to live with it and be happy with how I am. Um, yeah, the two, in hindsight, weren't related as much as they should have been.
What do you mean by that?
So I think the gender dysphoria was never there for me. Like it was in a sense, like I was unhappy with my body, sexuality, that sort of thing. But the bipolar fed so much into it that it became this obsession that would cause my happiness. And after I had the surgery and was discharged from their care completely, the depression continued anyway. So that, I think, to me should have been a bit of like a red flag of maybe there is something deeper going on here.
Mm-hmm. Yeah, and maybe it was hard to kind of notice or identify that that was a red flag. I'm sure that
Mm,
you wanted it to work out, so
mm,
that's understandable. And then I also wanted to ask you, when it comes to your bipolar disorder, I know, my grandmother had bipolar disorder, and she also had sort of delusions or psychotic episodes where she believed things were happening that weren't really happening. Was that ever something that you experienced?
yeah, definitely. Um, with that, because I'd suffered with it for so long, it just became normal. And it's only when I was speaking to the doctors about it, they were saying, "Oh, well, actually, most people don't have these grandiose beliefs or see things that aren't there." And that's when it really became apparent that I had this mental health condition.
Okay, yeah. And what do you feel like were the things that maybe you saw that weren't there?
So some of it was just like literally hallucinations. So
Mm,
seeing people which like I knew couldn't possibly be there, like dead relatives. There was also this sort of sense of paranoia, which this sort of belief that people were. I'd walk into a shop and everyone's looking at me and trying to figure out, what I'm doing there, and basically trying to find this deeper meaning when there was none. There were most people don't care like what you're doing when you walk into a shop or walk down the street or whatever. But there was always that constant fear of like, you know, they're not on my side. They're out to get me in some way.
Mm. Yeah, I can see how that would be really, really stressful to live with and really
Mm.
tiring and
Yeah,
difficult.
yeah,
Yeah,
definitely.
it must have been a real relief to get treated for that. How did did you have any issues with the medication for that, or was it smooth sailing?
It was difficult initially to actually get a diagnosis. Because I was in a depressive episode, and that's when I sort of reached out to the doctors and said, like, I'm really struggling here, help. And they just went on this route of, we'll put you back on SSRI antidepressants. But if you've got bipolar, you take those, it causes manic episodes. So it does treat it in a sense if it just flips your mood. So in the end, I knew there was something, there had to be something deeper. So I had to end up paying and going privately for more specialised mental health. When I first got the treatment, the sort of treatment that I'm on is called quetiapine. I believe it's Seroquel in the US. That when I first started taking it, I was on a very low dose, and it knocked me out for about like 18 hours a day. It was hard, but I've gotten used to it now. So if I've got the option to or the ability, I will sleep for like 12 plus hours. But most of the time, it's just standard 8.
Okay, yeah. And has it changed your day-to-day life? Do you feel have you has anything changed in terms of like your work, your job? I know you mentioned you're in a relationship. Is that new or was that, from before the medication? How has your life changed?
Um, it's changed quite dramatically, really. There's a concept that someone told me of the time horizon, and before I was treated, I couldn't look more than a week or two in the future, just because I was always in this fight mode, fight to survive. But since the treatment, my time horizon is extended to the point where now I'm planning, months and years in advance. I quit my job and retrained completely to a new field, which I very much enjoy. And the relationship I've got now is from after the treatment, where I sort of took some time to reflect on what it was, who I was, what I wanted from life and from a relationship, and formed it from there. So it's a
Okay.
lot more stable base that I've been working from.
Okay, that's excellent. I'm happy to hear
Mm.
that. Do you mind telling us what field you're in or what you do for work?
Yeah, electrician.
Oh, okay, very cool.
Mm.
Interesting. All right. And what did you do prior to that?
Prior, it was retail for
Okay.
8 years.
Okay. And you mentioned that the example of walking into a store and feeling like people were maybe out to get you, was that something that you had to deal with at work as well? Those feelings of
Yes.
paranoia?
Yeah, definitely.
Okay. Mm-hmm. And by the way, I noticed you have a dress behind you. Is that yours? Is that okay?
No, I'm in a friend's house at the moment.
Okay, I got you. I was just wondering if maybe you put that up to kind of represent something, but no, a
No,
complete
no.
coincidence. Okay,
Yeah.
I got you. Okay. All right. So, okay, you've given us a lot of information so far, and um how does it feel to talk about this, by the way? I just want to ask about that since I know it's your first sort of podcast interview. How does it feel right now to talk about it?
Initially, I was very nervous. Um, I'm not used. I sort of skipped a lot of time with technology, so I completely missed the whole Teams and like webcam chats and stuff like that. So I was a bit nervous in that regard, but also nervous about talking about it. But I do find it quite cathartic now to sort of tell my story. And there is still that hope that I've got underlying that my story can help other people to not make the same mistakes I did.
Yeah. Okay, so let's definitely, continue on that theme in a couple minutes. So we make sure we'll get to that. We'll cover that fully. But I also wanted to ask you, are you in any therapy now? Are you doing talk therapy along with your medications?
No, I kind of was originally. I had kind of like a care worker associated to me, and I talked to him I think once every 2 weeks. Um, and since I then started the treatment and whatnot, that sort of curtailed to the point I didn't feel I needed it. Um, I feel like I get enough support from friends and family now that I don't sort of require that extra help.
Okay, that's great to hear. I'm glad to hear that you have that support. That's so important, those relationships.
Definitely.
Yeah. And when it comes to your body dysphoria, do you still experience that right now?
Not really. There is, there's still, ironically, I feel like after going through the medicalized sort of transition, I've got some dysphoria now in that parts of my body I don't like, and I wish I had not gone through it. Because other than like the lower surgery, there was like breast growth, which the only option for me is to go through surgery again. Um, so there is that kind of aspect to it, but it doesn't impact me day to day enough to really worry me.
Okay. Okay. And um so how long overall were you on uh testosterone blockers and estrogen?
So I started taking it at I think 19, um, and I was on the blockers until I had the surgery at 23. Um, as far as it stands, I'm still on the estrogen purely because without because I lack any sort of gonads now. If I take testosterone or estrogen, there's nothing to regulate in my body how that is sort of managed. So, from my perspective, I'm kind of taking the lesser of two evils because I know from talking to other people who've detransitioned and gone on testosterone, there are like increased libido, like body hair growth, that sort of stuff, and I'm fairly settled with how I am. I don't want to do something that is going to drastically affect my body and then have to sort of get used to something else again.
Yeah, that's understandable. Definitely. I've talked to some detransitioners who kind of described a
Mm.
similar dilemma there. I don't know if you're familiar with Shapeshifter. That's his pseudonym, but he's a detransitioner. He's a gay man who had the surgery, had the vaginoplasty, and then, now it's this dilemma for him. Do I take testosterone? Do I take estrogen? And there's one thing about taking testosterone, which is that it's actually toxic to cats. Like this testosterone gel that you can get, I guess it's toxic to cats. And so that's, really upsetting for him since he has his cats. So there's all kinds of little things that, people would never think about. I would never think about that would be dilemmas for a detransitioner. So that's really tricky. And
Definitely.
and then to kind of lead us in, so if it's okay with you, I'd like to ask you a bit about the surgery. And maybe to kind of lead us into that, you could talk a little bit about how you mentioned you're hoping that your message can maybe help other people or give them, information that they need. What kind of stuff do you have in mind for that, for spreading awareness for others?
I'd say paramount is the mental health side of it. Um, if you aren't like, I think you really need to be settled in yourself before you make any of these major, massive decisions. And I know it's hard when you're in that moment, but it's important to step back and think, how am I actually going to be 5 or 10 years down the line? Um, I feel personally that the level of mental health support that was given prior to the surgery and going through the clinic and whatnot was just completely inadequate. I think I only had about 5 or 6, if that, hour-long sessions regarding like my family history and that sort of thing. But I feel like it's very easy to just say what they want to hear to get you through the process, and you think that is the goal at the end of it. I just feel that should be a lot more safeguards and checks in place before you're allowed to make that kind of decision. And I remember when I met with the surgeon, I was, excited to finally be going through it, getting the operation, and the way that he was talking to me and asking to look at parts of my body and that was more like a butcher, like thinking, oh, that I can cut this part off and do X, Y, and Z. The actual when I was admitted to the hospital, I remember admitted to this ward, had to have an epidural, put a needle in your spine to like numb your lower half. That alone, if you just think about it, is harrowing because they know you're going to be in that level of pain. So they have to stick a needle in your spine to prevent you from, going crazy from the amount of pain you'll be in. I remember I was taken up to the surgery room. They calmed me down, knocked me out, and then I woke up, several hours later. And it was just this sort of shock of like, where am I? What's gone on? Looking down, and it's just bandages everywhere. I was on a ward with five other people who've just had it done, and the sort of experiences that I was hearing for people who've had it done, 5 days before me, they're talking about blood loss, no sensation, that sort of thing. This is going to be quite graphic. Just to forewarn.
Mm-hmm.
So when they perform the operation, because it is essentially they invert the penis inside you, that wants to naturally close to a certain degree. So they have to pack it out with this blue tissue. And on the 5th day you're there, then they take it out. It's stuck to the inside of you through all the blood and other bodily fluids. And they quite literally have to pull it out, like rip it out. And you feel that in a way that you can't comprehend. You've never felt that kind of pain before. And then a few more sort of hours of observation. When I was there, I was finally allowed to shower on the 5th day, and standing up and walking around, I'd actually split the stitches. So they had to sort of quickly put that back together. But the only indication I had was just this warm feeling down my leg. That part was numb, so I had no sort of pain sensation for it. And then afterwards, the dilation process, for the first couple of months, for me at least, was absolutely just agonizing, because you've got all of the stitches, some of which are literally like inside you, and you're pushing an object which is then pushing those stitches against your own tissue. So it feels just like little needles poking inside where you probably shouldn't be able to feel. Other sort of aspects, like you kind of have to almost learn how to pee again, because the urethra is shortened. So when you go to the toilet, where you would expect to feel it coming out just isn't there. So it's a very bizarre sensation. I just remember there being a lot of pain and kind of body horror to it.
Yeah, definitely. There are a lot of threads in there that I want to follow. So, for one thing, was it numb initially because they were giving you something? Were they numbing it, or was that just the numbness from the surgery?
I think there was an initial sort of shock, like numbness from the surgery. I was also on a morphine drip, and the nurses said to me that if I was still on the morphine by the end of the day, then I wouldn't be able to walk around the ward the following day. So there was a very large aspect of, I don't want to be confined to a bed. So regardless of the pain that will come, I will just push through it. And then from that point, the strongest sort of painkiller I was given was paracetamol and ibuprofen, which are just over-the-counter normal painkillers. I wouldn't really say they even took the edge off. It was just like, give me anything that might help.
Yeah. Do you still experience pain in that area?
Thankfully, not anymore. I think after about maybe a year of things settling down, I still, I think, occasionally have a sort of random twinge of a nerve, which is, it's more sort of an unusual feeling than a painful feeling. But certainly that first year, not being able to walk for more than like 5 or 10 minutes before the pain was too much. Also, not being able to sit down. That is something that is so like taken for granted when you just can't sit on a chair.
What did you do instead of sitting? How did you deal with that?
Kind of like lounged sideways a lot,
Yeah.
or just laid down.
Mm-hmm. Okay. Wow. Was there anybody with you in the hospital when you woke up? Did you have anybody there with you?
No, because the sort of visiting hours were what they were. By the time I woke up, I think it was like 6 or 7 in the evening, and no visitors allowed. So I just woke up, just on my own. There was the other patients on the ward, but the curtain was drawn. So yeah, just waking up like, and coming out of general anaesthetic, not knowing like where you are, what's going on. It was quite a scary sort of experience.
Mm-hmm. Yeah, I can imagine. Was the surgery about 7 hours?
I really can't remember, to be honest.
Okay,
It's so
that's
long
okay.
ago.
Mm-hmm. Yeah, so you mentioned you woke up about 7 hours later, so I was just wondering if that was, if maybe it took a long time for the anesthesia to wear off, or because I have read the surgery can take up to that long, but it doesn't always.
It's definitely possible. I know
Mhm,
that waking up from the anesthesia, the sense of time is all shifted around as well.
mhm.
So it's definitely like, possibly that long.
Okay, and did your surgeon come talk to you after?
Not on the day, no. He, I think he came the following day, and he was sort of walking around the ward talking to people, and the focus was never on how are you and how are you recovering. It was very much I mean, I remember the conversation really distinctly. He was talking about how he was on holiday the next week on his yacht, and I was thinking, like, I don't care about your yacht.
Yeah.
Um, and he'd sort of walk around with, I think it was the head nurse, and they just lift the covers up, have a look at his work, and then just go off to the next person. There was never this sense of care from him. It was more of, if I'm honest, almost like I got I've got the impression that he felt like a god. Like, look what he's done. He's took this man, turned him into a woman.
Yeah, wow. And I mean, the fact that he would talk about his yacht is
Mm.
so offensive because even if this was, let's say it was some other kind of surgery, and, let's say it was like getting your appendix removed or something very, not natural, but something very acceptable, and we know it helps you, we know it saves life. Even then, if the surgeon was coming in and saying, oh yeah, with all the money I've made off of you, my patients, I'm going to go enjoy my vacation, something like that. It's just very insensitive. It's not an appropriate thing to say.
Not at all.
Yeah. Were the other patients around you, had they had the same surgery? Had they also had vaginoplasty, or were they different procedures?
No, they're all the same. Yeah.
Wow. Okay. So he had like his little factory line going there.
Mhm. Yeah.
Vaginoplasty. Wow. Are you going to disclose his name? Are you okay with telling us who that surgeon is?
Uh, Maybe in time, but
That's okay. Mm-hmm. Yeah, that's understandable. Completely. We'll leave that. And if you can remember the name of the gender clinic, I would love to know that, or maybe we could look it up after, something like that, just to
Yeah.
get that. And then, so going back to before the surgery, you said you had about 5 or 6 therapy appointments. So that's really, jarring to hear that it was so minimal. So tell us a little bit about that. What was the therapist like for you?
So they they weren't impartial. They worked for the gender clinic. So it was almost in their best interest to make sure they had the people who, they could tick them to go for surgery, to go on hormones, that sort of thing. I remember the first two I had, and these were 6 months apart, or quite a long time periods. The first one I had, the therapist there was more interested in my family history and any other sort of inclination of any gender issues, that sort of thing. Sexuality as well was somehow relevant to that. Then there was never a case of, are you okay? Are you sane? Are you happy? It was just like, have you have any history of this, history of that? Do you smoke? Do you drink? The second one was this doctor I saw, who I cannot remember his name. I remember his face really well, but he was more interested in the sort of biomedical side of it. And I at the time, out of this focus I had for it, I got these hormones online. Because back then there was really no sort of regulations or controls. You could just get them off the internet. And when I mentioned this to him, that I'd been self-medicating, he said, "Oh, we can't have that. I'll just put you onto hormones and blockers, so you can get them officially." There was no sort of like, is this the right thing for you? It's just like, oh, you're already taking them. Okay, I'll give you an official route to take them. And then the next couple of appointments were with the surgeon, where he was discussing exactly what he was going to be doing. There was no deeper sort of therapy. How are you? It was more ticking boxes and then getting you through the machine.
Yeah, and so with the 2 different therapists, was it altogether about 5 or 6 appointments, or was it 5 or 6 with each of them?
No, in total.
Wow.
And
Okay.
I think 2 of them, I would say, with the surgeon. So not someone who was really interested in the therapy side of it, just interested in the physical.
Right. That's what they say about surgeons, is they want to cut, right? So it's like hammer, nail. What's that
Yeah,
expression?
exactly.
You're gonna hammer, everything looks like a nail. So the therapists, they didn't uncover anything about your bipolar. That didn't click. That didn't surface at all.
No, I think they'd seen I'd had depression in the past, which was then treated with SSRIs, and that stopped the depression. But there was never this link made of, oh, you seem to have these depressive episodes twice a year, and then we give you the same antidepressants, you come out of it. There didn't seem to be that sort of desire to search for a deeper meaning behind it. It was just like, oh, okay, that has happened, let's move on.
Wow. Okay. And have you at all gone back to anyone, any of those 2 therapists or the surgeon or the clinic, and told them that you've had regret?
So when I first detransitioned, I was urged by family members to speak to a doctor about it. And I did, and I asked for a referral back, which I never heard back from. The doctor, I don't know if it was like a lack of knowledge or whatever, but he actually asked me for all the contact details and didn't really know what route to go through for this referral. I have found out since that I would still be on their records, but I feel like there is a certain sense of personal responsibility that I have to accept. But I do feel there's also been a lack of a duty of care by them, and I do feel failed by them. So I do not trust them at all, and I would not want to go back to them because I have no idea what they do to me.
Yeah, I can understand that. It's like this is what happened the first time you went to them when you put yourself
Mm,
in their hands, and it's scary to think about
mm.
kind of going back to them. Um, when it comes to the surgery, was it a typical penile inversion, or were there any grafts used? Because sometimes, for people who don't know, grafts are used from the colon or even from, I think, sometimes the inner thigh to sort of line the inside of the canal of the what they call the neovagina. Was anything like that used in your surgery?
No, it's just a standard. Well, it feels like such a bizarre word to use. Standard,
Yeah.
a typical penile inversion.
Yeah, right. So when do you still dilate? Do you still have to dilate?
Unfortunately, even at the time, it was really difficult for me to do that. Just the canal that was made was very narrow, and it always gave pain to do so. Coupled with the bipolar, when I was depressed, it was so low on my agenda that I didn't think about it, and I just stopped. And now I'm at a point, even now that I'm treated and fairly euthymic, they call it. Um, I don't anymore. And when after I had the surgery, after I'd recovered and whatnot, I was with a guy at the time who was, just a sort of standard guy. He wanted to have sex. Any kind of sexual encounter with the vaginoplasty was just painful, and it made me not want to sort of interact with it in that way. So as it sort of goes, I'm not interested in having any sort of sex with it or dilating. It's just a sort of a nothing to me now.
Okay. And with the not dilating, does that cause any issues? Where I've heard from other detransitioners that if you stop dilating, it can kind of close with little pockets staying open inside and cause infections. Have you ever had to deal with anything like that?
Thankfully, no. I think I've been quite lucky in that regard.
Mm-hmm. Okay, good. I'm glad to hear that. Have
Thank
you
you.
had any other complications with it?
I have not specifically with the surgery, but with the transition process in general. Um, so I've got osteoporosis, which seems to be because of the hormones. I had a couple of rib fractures a couple of years ago, and I broke my jaw. And then it was referred to have some scans, and they found that I've got osteoporosis, like worse in my spine. So it doesn't really affect me day to day. I just have to be careful not to like at work fall off ladders and things like that.
Okay. Oh,
But I've also got, I had last year a blood clot in my leg, DVT, and my right leg became ridiculously swollen. I couldn't walk on it. It was so painful. So I had to go to hospital, emergency room, and get blood thinners. And what they've said now is that I will have to be on blood thinners for the rest of my life because there was no injury that caused the blood clot. They feel that it was the hormones and the sort of lifestyle choices around it.
okay. What do the lifestyle choices include?
The hormones, really.
Okay. Okay, so the estrogen.
Yeah.
And and then and if a couple more questions about the surgery, but if anything is
Mhm.
like too invasive or if you don't want to go there, that's completely fine. You can just mention that. Did you have to get laser hair removal first? Because I've read sometimes there's laser hair removal required because otherwise when the inversion happens, there can be hair still growing in there, which could be incredibly painful and dangerous, risk of infection and things like that. Did you have to deal with the hair at all, laser hair removal?
No, I didn't really, to be honest. I didn't get like laser hair removal, but I think I was sort of lucky in one regard in that I didn't have much like hair to begin with.
Okay. Okay,
Mm.
and then what about revision surgeries? Did you ever have to go back under the knife for any
Yes.
revisions? Okay, tell us
So,
about that.
so for me, it was where they created the sort of neovagina. The bottom of it had started to, rather than just remaining where they'd done the incisions, it started to heal upwards, which meant the opening was a lot smaller, and it made the dilation I was doing at the time very difficult. So I went back in for the follow-up appointment like 6 months later. Surgeon had a look and identified, they're not supposed to do that. So I think maybe a couple of weeks later, I was invited back to the hospital. I had the revision surgery under general anaesthetic, but I was only in for the day, so I was out the same day.
Okay, what was the recovery like from that one?
That wasn't too bad. It was nowhere near as bad as the first sort of recovery. That I was still undergoing the recovery from the first operation at the time of having the revision. It was, for lack of a better term, it just felt burning constantly. Um, like someone had literally lit a match and was holding it to my skin. And that probably went on for a couple of months.
Oh, wow. Okay. And so there was just one revision surgery?
Yeah.
Okay. And then again, if it's too invasive, that's totally okay, but have you had any issues with urination more recently, or does that work okay now?
It seems to be fine. Yeah. I
Okay.
didn't, other than the initial sort of sensation of the urethra is not how it should be. Um, I think I was quite lucky with that.
Okay. Okay, good. And then what did it feel like when you mentioned that horrible, excruciating pain of the sort of gauze or whatever that was being pulled out? What were your emotions like at that time when you woke up after the vaginoplasty? And were you, relieved? Were you excited? Were you nervous about it? What were your emotions as you started to heal, as you started to maybe when you looked at it for the first time? What did that feel like for you?
I think initially it was very much like 'cause it was still like the inflammation, the stitches and whatnot. It looked like a car crash. So it's very much like, I hope this heals and I can look more quote unquote normal. I think I definitely felt some relief because I'd finally done the step to get me away from being a gay man. Um, and then over time it was just sort of became kind of normal to me. I think the thing that's a kind of, I don't know, ironic perhaps. I, 'Cause I never really I've always been interested in men, so I've never seen firsthand what a natal, well, just what a vagina looks like. So I had no basis for comparison. Um, so for me, it was just like, this must be just normal. The surgeon knows what he's doing.
Mhm. Okay. And did you feel like you were a woman? Did you feel like you had completed that process?
In a way, I did feel like I finally got to the place I wanted to be. Um, I never, I think, appreciated at the time the fact that, I was going to the women's restroom, that sort of thing, and the effect that might be having on other people. I was more just sort of head down, go in, come back out, do what I need to do. Um, but there was always that part of me, whenever I used the word woman to describe myself, it just didn't feel right. There was always just this little voice in the back of my mind saying, that's not right. Something is wrong.
That's really interesting. So something was
Mm.
nagging at you, some kind of
Mm.
voice of truth or inner conscience was nagging at you. Um, did the surgeons or the therapists tell you either that this will make you a woman, or did they tell you you already are a woman?
Uh, no, I think for me, I kind of skipped that affirmation model. I think I was sort of there as it was in its infancy and starting to develop. So for me, it was they'd sort of say, this will help your dysphoria, that sort of thing. Um, but looking at the whole model now, where people are told, as long as you say you're a woman, you are a woman. I didn't really have that experience with the clinic.
So when you were in the therapy, the very short-lived therapy, you mentioned that it was kind of telling them what they wanted to hear. So how did that feel? Did you feel like this is a means to an end? I've got to do this. I've kind of got to just get them to play along with me or deceive them. Was that the sense? Or did you really believe the things you were telling them that you needed this surgery?
I think there was definitely a part of telling them what they needed to hear, like not going too much into why I'd felt depressed in the past, because I thought, if they know too much about my mental health or physical health, then they might just kick me out the clinic and process altogether. But there was that part of me that genuinely felt that if I do get this surgery, I'm put on the hormones, then I will finally be happy and at peace.
Yeah, so that's understandable that you felt like if I can get this, I will finally feel peace and happiness. So why shouldn't they give it to me, even if I have to maybe manipulate them? Or is that accurate? For me to say that you've maybe kind of manipulated them, or is that inaccurate?
I feel like it was easier to just not volunteer information, just answer the questions they are presenting me with.
Okay,
So
that
rather
makes
than,
sense.
yeah,
Hmm. Yeah, and do you feel like on their side that they were kind of trying to push you through to this? Did they feel like also the same sense of this is what he needs, this is what will bring him happiness? Were they open to other possibilities? Like, I guess what I'm asking is, did you feel like they were open to 50-50? It could go either way. Yes to vaginoplasty and medical transition, or no? Or did you feel they were really set on the one path?
definitely set on the one path. From the very first appointment I had with them, it was very much like, when you get the surgery, not if you want it. That was always the goal uh, for them to put me through.
Okay. Yeah. And that's so sad to hear.
Mm.
What was it like when you kind of fast forwarding? So you got this surgery, and I guess actually before I get to when you first started to feel regret, I guess I want to ask you about kind of the intervening years where you had the vaginoplasty, you had it done, and then what was dating like? What was your health like? What was your mental health like during that time? Kind of paint a picture for us of those intervening years.
So, relationship wise, I was with a guy for about 10 years who knew me as I'd started my transition. And he had been supportive of the transition process. Um, so I didn't really have a problem like going through the surgery and stuff and worrying about dating because he was there. After uh, we split for unrelated reasons, um, dating was a bit weird because I didn't really, I never really had to do it before with the body I had. And when I finally decided to detransition, I told a good friend of mine I knew he'd be supportive. He's the first one I told. And we actually are now in a relationship. Um, so I've always had sort of quite good sort of support in that way. And I've been honestly, I feel like I've been really lucky. Um, in the intervening years, I didn't go to any sort of therapy or sort of counselling, even though I feel like it would have benefited me, uh, especially to help with the underlying mental health issues. I think it was more just going back to this flight or fight, dealing with the bipolar, and it just didn't really enter the back of my mind. I've finally gone through the process. I don't have to do that anymore. This is my identity. I know who I am. And it just became my normal day to day.
Okay. Yeah, go ahead.
There was always that fear in the back of my mind of, if I don't do this, if I don't put on the right makeup, if my hair isn't right, then I will be clocked and figured out and, chastised, lose friends, lose my job, that kind of thing. And that fear constantly there, it's just draining, because you shouldn't have to do anything for any sort of public perception, or it should always be about you. Like, dress how you want because that's how you want to do it, as long as it's not offensive or, that kind of thing. I think as I've gotten older and arguably wiser, but not definite, I've learned I just don't care what other people think of me. I only do what I want for me and those around me.
Yeah. And so did people at your job not know about your history?
That's the thing I've never been able to quite reconcile, because I'm sure they must have known, because some of them I'd known for like 5 or 6 years. But the situation I was in was someone who knew me before essentially outed me to the place I worked. And then I would have people come up to me and saying, like, oh, that's really bad, I had no idea, that kind of thing. But I can't fathom that these people didn't know. Like, surely someone, I worked with, like, because I was in retail, probably about 200 people. Like, there must have been some people that figured it out. But in the moment, in that time, it was just that I couldn't fathom that could happen. I thought I was, passing flawlessly. No one would know.
Yeah, and I mean, also you were, dealing with undiagnosed bipolar, so I'm sure that played a huge role in that, in your sense of how do people perceive me and things like that. When you were diagnosed with bipolar and then you were put on medication, how long after that did it take for you to start thinking differently about your transition?
To be honest, probably about a month. It wasn't that long at all. That was when I had started to get over the intense fatigue the medication caused. Then I could actually start really thinking again and thinking clearly. I felt like something was wrong, and I felt that I was not being true to myself. But I'd so much invested in that life. The person who I identified as for like 15 odd years, I felt that if I had come forward, detransition, there was so much that I would lose. So there was that huge amount of fear, but I kind of got to a point where I thought, I can't keep doing this anymore. I'm not just lying to myself, but lying to everyone else. I have to detransition for my own sanity.
Okay, wow. What was that conversation like with people in your life?
For some, it was quite straightforward. But for especially my parents, because they were just supportive the whole time, because they felt that it was, my body, my autonomy and my happiness. They definitely, before the surgery, and before the transition process, gave me a lot of like, make sure you are 100% sure, because you cannot undo it. When I told my mum about it all, she basically said, oh, for God's sake, I got used to that name for 15 years. Now I've got to try and go back to the other one. It's quite sort of funny, really. the sort of reaction I got from people. But it was largely supportive. People just seemed to understand.
Okay, yeah. And then I was curious, for your partner for about that you had for about 10 years, how did he identify? Did he identify as a gay man?
No, no, he identified in himself as a straight man.
Okay,
I
okay,
think for him, he had undiagnosed autism.
okay.
So I think with hindsight for him, it was very easy to put me in that box of I am with a woman. There is no question about it.
Okay, interesting. So maybe it was kind of that black and white thinking or sort of
Mm,
taking things very literally that I think comes along with autism at times. So, maybe he
yeah,
believed, like you said, this label was on you, woman, you've had this surgery. Had he ever been with a woman before?
no.
Okay. Okay. Yeah. And then your partner now, how is that going? How's that relationship going?
It's really, really good. Yeah, it's we're completely open and honest about everything, and a lot of the sort of detransition that I'm going through, because it's not something that you can sort of go to the doctor about. It's not like you said, getting an appendix removed, something that's run of the mill. You kind of have to reach out to people who've gone through it for support and advice. Um, there isn't like a book on it. So a lot of the emotions I have around it, I talk to him about, and he is incredibly supportive and just listens to what I'm saying. I feel I'm extremely lucky to be with him.
Well, that's good. A few more questions, but also just want to say thank you for being so open and sharing so much with us. Have you been able to connect with a lot of other detransition, or maybe not a lot, but a few other detransitioners? Has that helped at all?
Yeah, definitely.
Mm-hmm.
I reached out to a few on Twitter, um, and as I said right at the start, um, when I had basically written out this message to Richie, um, probably about 10 different iterations,
Richie
typed it
Heron,
on.
the
Yes, yeah.
detransitioner. Okay. Mm-hmm.
I'd written about 10 messages over the course of about half a year. And every time I'd think, right, I want to tweet this to him, private message. And I'd think, no, it's not quite right. That part might be construed as offensive, or I don't want to upset him, or that kind of thing. So just delete that, ignore it. 2 weeks later, do the same thing. And it was when you sent me a message, I thought, now is the time to actually talk about it and to reach out to other people who've gone through it. So thank you for that. Without your message, I probably wouldn't be talking to people.
Wow. Well, that's wonderful to hear. I'm very glad about that. Yeah, I mean that goes to show that just reaching out in different ways can have this ripple effect. So that's really good. And did you reach out to Richie? Did you message him?
Did
Oh,
I
good.
did in the
Okay.
end? Yeah,
And are you two talking
yeah,
now?
yeah. He's given me a lot of advice on the sort of minefield of detransitioning, what to avoid, that kind of thing.
Excellent. I'm really happy to hear that. That's very good. Um, and what do you want to say? Do you have advice for others at this? What do you want to say to kind of maybe people who are detransitioning or people who are considering getting the surgery, getting the hormones, things like that?
I'd say it's the surgery and the hormones are presented in a way of, this is what you need. This will make you happy. This will make you identical to a woman. What they don't tell you is it is like a poor simulacra. It's not the same, but they don't tell you about these differences and the impact it's going to have on your life. You have to be 100% sure that you want to essentially be connected to the medical industry for the rest of your life. So without the hormones being prescribed to me, the osteoporosis will get worse. I might, lose the ability to walk or that sort of thing. I'm now dependent on doctors for the rest of my life. I would say it's important to listen to every voice, even if you don't want to. If you think, this person's just there, they're transphobic, they're just out to get me, there may be truth in what they're saying. And just do the research. Don't just go blindly thinking this is going to cure all my problems, because it just doesn't.
Do you, is it something that you feel like you struggle with now on a day-to-day basis with your body, or do you feel kind of settled? How do you project for the future? Do you worry about how you'll feel physically, emotionally regarding the changes in your body?
So there's some definite sort of funny day-to-day things which are a bit of an inconvenience or problem. When because I work on sites doing electrical work, often there'll be the gents' toilet if I'm going to a fast food place before work, that sort of thing, and there's one cubicle in the gents and it's closed for some reason. Then the only choice I have is the disabled toilet, because I can't stand up anymore. That's a definite day-to-day inconvenience, which I think a lot of people don't think about. I certainly didn't when I first detransitioned. I don't worry about my health too much. I'm living as healthily as I can. There's nothing I can do to affect it. So I don't think there's much point in prescribing too much worry behind it. This sort of mentality I've developed over the last year is that you are responsible for your own happiness, and just try to look for the silver lining in everything. As much as it sucks that I'm now a 34-year-old man with no penis, there's nothing I can do to change that. So there isn't any point in giving it that weight to allow it to cause me worry. I just try and take each day as it comes, and just try and keep positivity.
Yeah. Okay. Really good message. Thank you for that. I think that could apply to a lot of people, even who haven't gone through something like what you've gone through, but that acceptance. And it is so hard in life if something happens and then you're fighting against it constantly, right? So that message of acceptance is really important. And then just as I sort of think back over our conversation, I just want one more clarifying question for you. So you first got on the testosterone blockers, the estrogen, around like 19, right? Around age like 19. And then did you have therapy prior to the lead up of your surgery? Like before those 5 or 6 appointments that you had where they kind of rushed you through into the surgery, did you have any talk therapy before that?
No, it was just those sessions that I mentioned. I had other therapy sessions through the NHS, but they weren't specific to the surgery. They were just general sort of talking therapy. But even leading up to the surgery, I don't think I was in that kind of care. So there was no therapy around that for me.
Okay. Yeah. Okay. Well, thanks for getting that straight. It's so sad to think about the way they just rush people through this, and they don't give that advice that you just gave about really think this through. Really think, do you want to be attached to this for life, the medical industry for life, and is this really something you want 100%? It is hard because people, when they think this is the right thing for them, it's quite hard to get through to them. But okay, this is my last question. Have you spoken to anyone who is considering transition yet? Have you yet spoken to anyone who's considering?
Not yet, no. I think because I live quite a like private life. Um, I don't have a like masses of friends and family. Like the interactions I've had on Twitter have been the most social media interaction I've probably had in like since MySpace. um, so I've not really encountered too many people thinking about it.
Okay, would you be willing, if people reached out to you, would you be willing to talk to people who are considering going through medical transition?
Yeah, for sure, sure.
Okay. Okay, something good to keep in mind.
Hmm.
All right, well, Sam, thank you so much. It's been fascinating speaking with you. I really appreciate you coming on, sharing your story, being honest and open, and I hope that we get to talk again sometime. So thank you so much for doing it.